Good evening. On behalf of the NYU Meyers Alumni Association, I'd like to welcome you to another Meyers Marvels event. I'm Mary Gallagher. I'm the president of the Alumni Association. NYU Rory Meyers College of Nursing is committed to producing lifelong learners who will excel in their nursing careers and be recognized as leaders who keep patient-centered care and the health of our society at the forefront of their values. Meyers graduates holds position of leaderships in profession, practicing in diverse clinical, academic, and administrative settings. The Meyers Marvels series shines a light on some of our most prominent alumni and faculty that have influenced our nursing profession. Tonight, we are thrilled to speak with Dr. Eileen Sullivan-Marx. Dr. Eileen Sullivan-Marx is the Dean of NYU Rory Meyers College of Nursing and the Arlene Perkins McGriff Professor of Nursing since 2012. She is the former president of the American Academy of Nursing, and prior to NYU, Dr. Sullivan-Marx had a distinguished career at the University of Pennsylvania School of Nursing, where she was the Associate Dean for Practice and Community Affairs. She is distinguished nursing leader, educator, and clinician known for research and innovative approaches in primary care, testing methods of payment for nurses, particularly with Medicaid and Medicare, sustaining models of care using advanced practice nurses locally and globally, and in developing health policy in community-based settings. Tonight's event will be moderated by Kim Glassman. Dr. Glassman is a clinical professor and senior associate dean for the academic affairs at NYU Rory Meyers College. Prior to joining the faculty at NYU Meyers, Kim held various clinical and leadership positions at NYU Langone Health, where she served as the Senior Vice President of Patient Care Services and the Chief Nursing Officer for 10 years. I am now turning over the program to Dr. Glassman.
Thanks, Mary Ann. And Dean Eileen, we are going to have some fun tonight. There's a whole array of friends and colleagues that I see here joining us. And I'm really excited that you're going to be sharing some of your many career highlights this evening. And I know that you have many more that can be addressed tonight. But throughout your career, you have stayed true to your core values. And we want to explore some of your core beliefs tonight that have carried you through your journey in your nursing career. So tell us your secret.
If I told you my secret, I'd have to charge you money for it. And I think that's one of the things that when I talk about career and leadership and knowing where one comes from, it's how do you value yourself? And I was privileged and had the advantage of growing up in large families, loving families that were steeped in faith, but with an eye toward the practicality and the service side, and also with a sense of, this world is big and different, and you can't always just think that the world needs to be the way you see it around you. It's much larger than that. Just to give you an example of my mother, who was born right outside of Philadelphia in Upper Darby, number 8 of 9 children. She had many aunts and uncles. They were a very strong Catholic family. And my grandfather, Logue, who was born in the United States, was of Irish descent, ancestry, but her mother was of German ancestry, Catholic ancestry. And so they, and they were very, he was always working within the Catholic Archdiocesan community. Now, why am I telling you all of this? because the network that I was introduced to as a child, and they had two daughters of the 9, two daughters who became nuns. And when I went to Catholic school, and I'll tell you about my father's side of the family, secondly, because they were not Catholic. But I went to Catholic school. I had these aunts who were nuns in the same order that taught. And I got the inside scoop on so much. In fact, they would sometimes use me. And I remember once my one aunt saying to me, well, how is that teacher you have is doing in 6th grade? And I had a teacher in 6th grade, and the woman obviously was going through some life changes, and she was overwhelmed as a teacher, and was just, always seemed to be one of those, not looking good, one of those people who are all yelling in class and that sort of thing. So I said, well, she's yells in class all the time. She's always giving us a lot of homework. Well, then all of a sudden that changed. So here, she's on some committee reviewing somebody. So I got to learn very early on that there are systems, the education systems I was familiar with. My other aunt, who was a nun, was a department chair for home economics, yes, at Immaculata College. And she would bring all of her nieces and nephews into the college. So as a young child, I got to meet people who were chairs, women who were chairs of the Department of Chemistry. And they said, oh, Eileen is really good in school. Let's take her around and show her the scientists and show her all the mouse in cages in the biology department. So I grew up with this very high level of familiarity with education and systems. On my father's side, while he's a Sullivan, his mother was a Boyer and of long Pennsylvania ancestry. And she had become a Quaker and lived in a more rural area of the town where he grew up, which was the steel mill town, about 10,000, but they lived outside of town and were part of a Quaker community. And so my father, the name Sullivan, grew up in a Quaker meeting. So I always tell people I was raised a Catholic. So I would both attend a meeting and attend Mass. And so when you grow up with that kind of ecumenical kind of approach, but one where there is a certain familiarity, a certain value set, friendliness, but large networking. And so I was always very comfortable with the idea that you just got to know a lot of people. And my parents and my father's sister in 1953 put their money together and opened up a diner restaurant in our hometown next to the steel mill offices, the hospital, the fire department. And so I grew up in a 24-hour diner that was the end of the bus line, where the community, you were a third space in the community, the third space being the first space being home, second space being work, third space being pubs, taverns, churches, synagogues where people hang. And so I grew up understanding how one is part of this network, and also that given that we're the third space, we're also a business and a family-run business. I was the oldest child, and I understood that business and prices of the hamburgers were part of everyday conversation. And so absorbing the finances and knowing how to think about finances was important. My mother had worked in a number of jobs before she married my dad. She married my dad at the age of 28. And she had done inventory, bookkeeping, accounting. She had been a switchboard operator at a hospital at one point. And after she was a switchboard operator, she started doing hospital billing when she was in the early 20s. And I give credit to her because when I was in my master's program at the University of Rochester for becoming a family nurse practitioner, in 1978 to 80, which was, nurse practitioner programs were rare. It was one of the ones funded by the Robert Wood Johnson Foundation. And she's saying to me, well, now that you're going to be doing these things that you say, you'll be doing nursing, but it's more because it'll be doing some of the things that doctors do. How are you going to get paid for that? Was her question to me. Like, how are you going to get paid for that? If, is that salaried or are you going to bill? And I then was like, well, I don't know. But we had to write a paper that semester for Loretta Ford, who was dean of the School of Nursing and taught a leadership policy course. And we had to write some issues course, like your issues and trends, Kim. And we had to write an issues paper. So I decided to write a paper on nurse practitioners need to be able to bill insurance based on my mother's question. Now, I ended up with a B in the paper. And I always reminded Loretta Ford of that whenever I saw her. But probably got a B because it didn't have a lot of literature citations, because there was only like one or two. ANA had a statement about it in 1965. And there wasn't much else to talk about. And I didn't really research and talk about billing. I just kind of wrote an essay, like, we need to do this. So I may have gotten a B, but if you think about it, I ended up basing so much of my career on, if we want to provide access to care, if we want to increase primary care practice, it changed the way nurses are used in roles. We're going to have to be part of the finance system. We're going to have to understand billing and how to bill. And what is this all about? And if you know my career, so much of it has been about the Medicare billing system, Medicare fee schedule. If you're going to open up new models of practice, as I did through the 1980s, it was always about talking with the people who did the accounting and the billing in any particular department, and learning what they do. And then how's the NP going to fit in this? Well, if it doesn't fit, then we got to change legislation. Then we got to change policy. Then we've got to do it at the state level. Then we got to do it at the national level. So how I ended up on a major national congressional committee to look at physician payment review and integration of nurse practitioners and others who bill into the American Medical Association and Healthcare Financing Administration's Resource-Based Relative Value Committee was through networking related to NYU. But I was at Penn, and I had been in private practice with my husband in New Hampshire for several years, nurse practitioner, family physician. And we decided, for a variety of reasons, to come back to the Philadelphia area. And I was enrolling in the PhD program, which Maddie Mezzi had been encouraging me to do for years. So I'm now in Maddie's office, coming back to Philadelphia at Penn when Maddie was there. And Maddie says to me, she's now an emeritus professor of NYU. And Maddie says to me, oh, tell me about the practice. And I said to her, I could do everything but bill Medicare. I could bill private insurers in New Hampshire. I could write prescriptions. I had full scope of practice, did not have to get anything signed by physicians. It was full scope of practice, but I couldn't bill Medicare. The next week or so, Maddie gets a call from Pam Middlestad at the American Nurses Association, who's desperately calling around looking for a nurse practitioner who understands billing to sit on this committee. And I get a call from Maddie saying, I just gave your name to Pam Middlestad. And I ended up on this committee representing ANA. And that just launched me then into really being able to make changes, because I could walk into a room and start talking about how I was billing private insurers for primary care, but I couldn't bill Medicare. I was blocked from it. And what that means for Medicare beneficiaries. And what I was able to do was link that to outcomes of care. Because if you don't have access because you're not in the reimbursement system, then outcomes of care don't change. And so the ability to put values with money and link that to outcomes, I think is a consistent theme for how I've always looked at whether I took care of patients in the hospital and you couldn't get supplies that you needed, whether you didn't have the right personnel. Where's the source of this problem, and how do we link all these things? And so it's networking, it's knowing systems, it's knowing finance, and it's personal relationships. So and it's taking what is in you from your roots and using that. So I don't, that's one thing, Kim.
Thank you. Do you want to take some questions?
Well, I mean, the other thing that people often ask me when, I'll start thinking of questions, everybody, and they'll tell you how to put questions on, because with a group this size, it's easy for all of us to join in a conversation as opposed to just hear me go on and on and on, because I could tell the story forever. So I arrived here at NYU, which, as I said, I never, I'm not an alum, but I was educated by NYU and mentored by NYU alum, because NYU sent out the ambassadors to be deans. So people who influenced me, many of them were from NYU. And I used to come to NYU to give lectures in Maddie and Diane McGiver's class on Medicare reimbursement and payment. So I arrive at NYU feeling like this is going to be a great stretch opportunity for me, a big place in a big city, friendly. It was somewhat discomforting, but because it's new and it was a stretch, but at the same time, and I left a place where I knew everybody. I mean, just like many of you, Kim, is someone like that in the NYU Medical Center. I was like that in Philadelphia. You just knew everybody who's been around forever, and you know who to call and who to help you influence. But when I came to New York, that wasn't quite the same. But I'm here for six darn weeks or so, and Sandy hits, and I barely had people's phone numbers as to who to call in the dark. And but we were able to, but I had Kim's number, although I didn't bother her. I had Barbara Krainovich Miller's number, which was highly important. And I had the number, the cell phone for Marianne Christopher, who at the time was the CEO of Visiting Nurse Service of New York and also a nurse. And so we were able in that first week to not only, I saw what Krainovich Miller could do to rally students and how to get people into clinicals and keep them going, and David Resto, who came walking across the Brooklyn Bridge to turn on all of our computers in the building. And then at the same time, I had enough conversation already at the university with the Office of Public Affairs and Community Relations that they called me to see if their students could help them in the Greenwich Village towers, where the university is landlords, because people were still there in the dark, running out of water, refrigerators, no longer keeping food cold, and they wanted to do some assessments. So with Amy Knoll's coordination, Barbara's, many other of our faculty, Kelly Bryan, I can't remember all, we were able to put together teams of faculty and nurses. And I said, I'll only go in if I can get somebody from VNS New York, because they can open cases. And once they walk in and see an unstable environment, they can do something about it without having to call 911. They can open a case, get and take care of whatever needed to be taken care of. And so that was the stipulation before I let any student or faculty. But I knew that that was an absolute golden opportunity to do what we wanted to do at the school, and that is make our vision visible, both to the university, to New York, to the world for nursing. As Kim was doing with her nurses who were guiding the preemies down the dark stairways and kangarooing them and doing all the things they needed to do, we were doing in the university and in the community what we can do. Now, how did I know that? Well, one, I wanted to be an emergency room nurse from the get-go. So that was my first world that I worked in as a nurse. What I loved about emergency is more about the community preparation. I love the public health aspect. The trauma cases coming in, that was fine, but I loved my regulars who came into the ER, people with sickle cell and hemophilia and asthma and cardiac conditions and that community sense. And so I was always interested in emergency preparedness, and I had been on the Philadelphia's post-Katrina emergency preparedness review committee, where we made a number of recommendations. So I was pretty well prepared to what one does in the middle of an emergency and a crisis like that. So I made sure that when we were doing that, that we were going to be able to publicize and showcase what we were doing, so that the university got informed by what our students did and what they could see. And that was a huge turning point for nursing at NYU, because the trustees, the higher administration of NYU got to hear the stories of what our students faced and the faculty when they went into these homes. And not only that, but what we did about it, what the outcomes were, and how it turned around on a dime, and was quite dramatic to them. And when we walked into those dark corridors and the doormen were knocking on doors saying, "Nurses are here," people opened their doors and started shouting in these dark hallways that echoed, "The nurses are coming, the nurses are coming." So we used that headline over and over again. And that was so powerful, that John Sexton held this party for us and gave us all pins and had all the students and faculty be recognized. So huge opportunities. So how you put all of that together, I think, is terribly important, and then open the doors and set the stage for a high level of visibility for how well the valuing ourselves and shouting it out and let people know what we're doing. And now with the pandemic, being able to do that at even a larger level than we did with Sandy, because of course the pandemic was international. And I was in a position at that time to really amplify nursing, NYU nursing, because not only was I dean of the school in the heart of New York City, where the pandemic was hitting, but I was chair of the Dean's Council of the university. I had been vice chair for 2 years. This was my first year as chair of all the deans. So I was on all of the small exec committees that were making every kind of decision one could think about in a university that had thousands and thousands of students from around the world, who they're responsible for, but also are a potential breeder of disease. And so there were a lot of decisions being made about not having students be spreaders, but not having students get sick. And how do we make sure that happens, but also then instructing the other deans. I was a resource for all the deans about what one does in crisis management. It was an afternoon session with deans where I said, all right, this is crisis management 101. Here's the things you need to do starting tonight. Step 1, do this. Step 2, do this. Step 3, do this. And so they all did it because they're all good leaders. So, and then being able to be a president at the same time of the American Academy of Nursing, and being able to then amplify and use the resources of NYU's communication to get on to MSNBC, CNN, a couple other financial news, Yahoo Financial News, things like that, that we then ended up having me be the first nurse in any of those large venues. A&A followed, but because I think of the quickness of NYU communications, I was on some of, I probably, like Fauci, was saying things that weren't absolutely, like, we weren't masked at that point. Although when I went into the studio and everyone was really like nervous in the morning, and I was like, don't touch me. Stay away from me. We're going to stay distance around here. And then, after I did the session with those reporters, I mean, with the people who are like sit at the table, and are sharing the news and kibitzing, I said, you're not going to be able to sit this close together much longer. And, within a week, they were like on either side of those big tables. So, so anyway, I think that, again, it's using the strength, the power, what how you can use your networks and communication style, and know that you have the backup and support, and just go for it and take a bit of risk sometimes. Yes, it was a risk to walk onto MSNBC. I knew generally what they were going to talk about, but they did ask me, they put up a graph I never saw before and said, well, what do you think will happen if we are predicted to be that high? And what did I say? I said something about, well, if we do this, we won't get that high, we'll be there. But if we get that high, we'll be in a pickle. And we got even higher, and we were in more of a pickle.
Right. I think you told people to wash their hands also.
Yes. I kept saying, wash your hands, so you can't go wrong. And with that, so I think that one of the questions I had for myself, because it was pretty intense being dean on Dean's Council and president of the American Academy of Nursing. I could have stepped back from all of that and say, look, I just got to run a school. We can't use the academy. The academy's just got to keep a low profile. I can't handle all this. But I decided to put them all together and make it bigger than what it could be, and make the whole larger than the parts. And I found at times other parts of myself just taking over. I'm sure, Kim, you had that experience at times with the evacuation during Sandy. You just let the instruments in your body start to flow like you do in any emergency. And I just allowed the things that I knew I could do well come together, and people received that and responded to it. And any idea I had, I didn't question. I would say, let's make sure we can get into the public health service. I sent in a message to Susan Ortega, who had visited us during Estelle Osborne and was a speaker, who is now on the TV with Trump and everybody as part of the core. I sent her a message and said, how can we help? And she got back to me and said, any way your faculty could come up with some kind of instructions for my nurses who are going to be at Javits Field, and they're good med-surg nurses, but they've never done ICU. And if they have to work vents, they need something. And Mary Brennan and Leon Chin put together apps for them in like 2 weeks' time. And Susan Ortega, when she goes around talking about the COVID experience, she uses that example, that you got to reach out to your colleagues at academics, because you got to know who people are that you got to call at that moment. And that was one example of many at that time. And at the same time, I had Kim in the associate dean role that she just accepted for academic programs, who knows everybody in regulation and leadership and Albany, and all of a sudden, we wanted to be able to make sure that all of our nurses, all of our nursing students rather, finish their degrees on time. NYU was great. State of New York was great. Kim was great. And we got that moving. And Sean Clark, who was the executive vice dean, and Ellen Long, my finance administrator, I could hand a number of internal operations over to them, and they chaired with Lance Irving our internal College of Nursing COVID task force that ran for 2 years. And they just then gave reports to me. I didn't operationalize that because I was on too many committees at the university level. So it's when you have it was a transformational leadership moment where you're outside of just nursing, but your nursing self is making a difference in larger areas. So that's something that I need when I step down as dean to write about. And I don't have time to do it now, but it's a very important part of growing your leadership for yourself from when you're teenage, early young adult self all the way through. It's a journey of leadership. So do we have questions?
We do. And so you've raised two key points. One is take advantage and build those networks. And the other is never waste an opportunity. And I think that you were able to put all of those together. We have a wonderful question from one of our accelerated students who has noted, Dean Eileen, that you emphasize the importance of innovation. And she noted that we were able to transition really quickly to remote learning during the pandemic. So could you speak to some ways that you stay ahead of the curve and use innovation to kind of inform the future? And how do you do that in this crazy fast-paced world?
A great question. Thanks, because we have ChatGPT. ChatGPT is 65 days old and, has taken over higher ed in a minute, I think. But it's a remarkable tool. So how are we going to use ChatGPT in nursing? I mean, there's a lot of interesting things that it might be useful for, save us time and effort. I think you always just have to be curious and read widely. A lot of times people tell you read outside of your own world. Read magazines. If you're in a magazine store or browsing for something to read, pick something you don't know anything about and start reading it. And someone gave me that advice years ago, and I've always done that. So it's kind of like stay ahead. You don't have to, read deeply in it, but you should know, something about transformers, or you should know something about archaeology or something about this or that. And I think that's important to stay ahead. To give credit, the faculty and the prior dean and dean's interim dean of NYU were already thinking about that before I came, because this building was built to be innovative and to address the future of what simulation and education could be. We hadn't used all the tools available to us just yet, so that we could, knowing that we had those tools, we could flip to them pretty fast, and our faculty embraced, well, let me see how I can use this and figure this out. And Krainovich Miller is on this call. She was on the committee to plan this building, and that I'm in right now. And the lights may go out if I don't move enough, because they're on to save the electricity. But I think that's that's how I do it. And you listen and you're always thinking. And so we have embraced hackathons and things like that, and find those people around you who want to do the same thing and let them go.
Great, thank you. We also have 11 doctoral student Jonas Scholars of Barbara Kranovich Miller who want to know the process for becoming a dean.
The process for becoming a dean is a long and winding road, and it's not the same in every place and every situation. So from a practical point of view, universities look for leadership, and it'll vary, you know, in certain decades. Another decade they'll want this kind of a leader or that kind of a leader. Sometimes they want leaders who are going to build their research portfolios, sometimes, and have done lots of research. Sometimes they want a leader who's going to straighten out finances. Sometimes they want a leader who's going to build a new building. Sometimes they want this or that. And I didn't decide that I wanted to be a dean. There was a panel years ago at Eastern Nursing Research Society, in which they had a panel of different deans saying, how did you decide to do that? Paula Malone Nuzzo, who was dean at Penn State and for many years, and prior to that had been at Yale, she intentionally decided she wanted to be a dean, and got her doctorate in education and higher ed purposely for that matter. But she didn't become a dean for quite some time. She stayed at Yale doing different projects. I never intentionally went to say, I want this kind of an administrative background, or I want to do this. I am someone who's fairly eclectic. I had a Bloomsburg editorial board reporter speak to me this week, and she read the bio about me, and she said she particularly wanted to talk to me because in my bio I had so many different things that could speak to the nursing shortage. I wasn't just an academic. I was not just a hospital operator. I had done a lot of those things and had been engaged in many things. And so while along my career, there were times when someone said, well, you're not like doing this or doing this, but now I have this mosaic that fits a lot of different things, but that takes time. So the road is very, very different. You have to be authentic to yourself all along the way, and be okay with that, because there'll be times when there had been some other schools that looked at me for a deanship, you know, in the 5 years or so before I came to NYU. There were never any, well, anyway, one I decided not to pursue because I didn't want to leave Penn. I wanted to finish what I was doing at Penn. Another one who flat out, like, we don't even want to interview you because I didn't have something that they wanted. And, you know, but yet NYU was an opportunity where they were looking for someone with my kind of background who had a lot of higher ed experience and a lot of integration. In fact, when I applied for the job and sent the CV to the search firm, I had a lot of committees because of the role that I had at Penn, a lot of committees. And I thought sometimes that looks like you're just this committee wonky person. So I said, should I take those committees off of the CV? And she said, no, I think you should leave them on. And it was in that spirit where the depth of understanding of how universities work and are integrated into the larger environment was something that worked for what the leaders were appreciating and what I could bring to the deanship at NYU. So I hope that helps, because there ain't no one way to do it.
Great, thank you. We have another question of what do you consider your greatest achievement in this role of dean at NYU?
Oh, and dean at NYU.
Yeah.
There's many small things, and and some of them have taken 10 years. And so the one thing I want to say to you is you come in and you can make a list of things like, well, we should do this a little better, like getting students into the university honors program. We finally did that. It took 10 years before we got students into that course. So there's a lot of small things, but the greatest thing is the great understanding, internalization, and appreciation for what it is we do at Nurses among society and using NYU to move that forward. And yes, the trustees now really understand why the nursing school is the jewel in the crown to the place, the presidents, et cetera. But it was using the instrument of the talent of NYU nursing to be one of many, but I think one of the foremost players in how the world sees nursing now. Because we put it out there and they listen, because we're in New York, we were NYU.
Yes.
I don't know whether my colleagues here would agree who went along this road with me here at NYU, but they might come up with some, but I think that's the big thing.
Yes. And then we have hopefully time for one last question. One of our doctoral students who also practices nursing at Mount Sinai lived through a recent short strike and is noting the important challenges that nursing is facing around recruitment and retention of nurses, and wonders what your thoughts are as the dean of the NYU Meyers College of Nursing about what nursing schools will have to do to address this challenge going forward.
So when I first became dean at NYU, and you get an opportunity to speak, to the trustees at the trustee meeting, and one of the trustees asked me that exact same question. It's not a new question; it's been around forever, and so there you are. Like, how am I going to answer the question of, now, mind you, one of the worries at NYU in the leadership was that somehow there wouldn't be enough applicants for the nursing school and that the enrollment would dwindle. And in my interviewing, I said, are you crazy? What, have you been under a rock? This is how I talk on interviews. Of course, you're going to have so many admissions, we won't know what to do with them. And that was Provost McLaughlin at the time. And he still reminds me of how I answered him that day. And I said, what, do you think there's not going to be enough enrollment? I mean, could have to, already there's more people who want to become. And now, of course, we have at NYU the lowest admission rate for applicants. That percentage is less than Stern, it's less than Harvard. We can only accept a few students for the 3,000 applicants we get for the traditional program now. It's so, and he says, boy, you were right. I said, the floodgates are open. So nursing schools aren't the answer. That's what I'll tell you. We're not the answer to that problem. Who's got the answer? We don't have the answer. Society has the answer. Society has to have a will to do something about this. And we've done everything we can, but society has to partner with us on this. And this is what I've been telling Bloomberg News. So look for an editorial out of Bloomberg News on this. It's not us, it's everybody. Everyone's got to get all in on this, because how one becomes a nurse, and society wants nurses. We've always been part of humanity. So, we can only educate so many given how we do it. So that I think that the partnership will have to come from funds. The partnership is going to have to come from thinking about nurses in other ways besides white women. Thinking about how one enters into the field and is rewarded and valued for that work. So all of those things. So I usually turn that right around. So when I answered the trustees, I said, well, you know, how can we answer the nurse shortage when we only have one gender predominantly? We're a single gender institution. I know Fidel's on and we've got everybody, but they've heard me say that. It's a single gender institution because you as trustees, when you refer to a nurse, you refer to a nurse and a male nurse. You should just be talking about nurses. And so you have this image of a nurse in your head. We don't accept that image. So let's straighten this out, and you got to work with us. So we're getting close to our time, are we not, Janet?
So of course, I'm thanking you and I'm on mute. So thank you, Dr.
Well, thank you for having me and all of you for joining us. Hi, everybody.
And Kim, thank you for being our interviewer and keeping us going, keeping the conversation going. Much appreciated. And thank you to all who joined us tonight. So my takeaway were how we bring our roots with us. That always is a part of us. And that throughout life, and especially in our career, there's times where we're being influenced and times we're influencing. And so that's kind of like a cyclical thing. And the other, what I've noticed through participation in the Myers-Marvels series is the importance of speaking up. That has been a theme from each of our Marvels, to speak up. So that's an important takeaway. And then I just loved, of course, that we're the jewel in the crown of NYU. So thank you for everybody attending. After tonight, you'll receive a survey later this evening, encouraging you please to share your feedback so we can improve our program if needed and hear things that you'd like to hear. Our next Myers event is the Estelle Osborne Legacy Celebration, which is coming up February 22nd at 2 p.m. The registration link is in the chat, and we hope to see you there. So thank you all very much and enjoy the rest of your evening.
Thank you.
Bye, everyone.